Okay, this is going to be a long one. Summer is coming and everyone is fixating on their hair. You don't need to remove your hair. If you want to remove your hair because it makes you feel better, then great, remove your hair. And there are so many different ways to do it. I wanted to sort of talk through the options out there so you can make the best choice for you, because it's amazing how many people injure themselves, cause an unwanted reaction, cause an infection with removing their body hair. So when we think about removing our hair, the easiest way to do it is shaving. And you can shave your face, you can shave your body. On the face of women, it's oftentimes called dermaplaning. But it's the same concept. You're using a razor and you're removing hair. For your body, like a leg razor like Venus is probably the most common thing that's used. On the face, there's these short dermaplane blades that are really easy to use, and those can be bought very inexpensively on Amazon. There are the fancy ones like the Dermaflash, which is sonic and vibrates at the same time. When you shave, you're going to be exfoliating your skin as well as removing hair, and that means your skin's going to be more sensitive afterwards. So after you shave or dermaplane, you really want to stay away from your active ingredients or your treatment ingredients for at least a couple days. So if you shave on Monday, you don't want to go back to your vitamin C until Thursday morning. Same is true with your nighttime exfoliators like my night treatment or glycolic acid or tretinoin. You want to give yourself at least 48 hours for your skin to recover. Now the bummer with shaving is so often our face sort of feels different. You sort of feel like a cat who's lost her whiskers. One way to deal with that is shave or dermaplane at night before you go to bed, and then that way in the morning your skin will feel a little bit less raw. Moving on, other things you can do. There are electric razors or electric trimmers. Those are super easy to use. They really aren't going to affect your skin much because they don't do that close of a shave or that close of a removal of the hair. So you can really do it anytime, anywhere, and just remove the little hairs that you don't like. Both the electric trimmers as well as shaving can treat all hair, white hair, soft hair, or the vellus hairs, dark hairs. And when you shave, just know that when the hair grows back, it's not going to be more coarse, but because you've cut the hair in cross section, when it grows out, instead of having that nice tapered front, it's going to feel coarser because you've cut it in cross section when you were shaving it. Now, other options that you can do, it's been around for forever, but there are cream hair removals, and that's like Nair, and the way that works is it actually destroys the keratin in your hair, but you also have keratin in your skin. So if it sits on your skin too long, it can really be irritating to your skin. I do not recommend cream hair removals for people who have really sensitive skin, people who have rosacea. If you're going to use this treatment, you want to skip any sort of exfoliation for the 3 days ahead of time. You want to moisturize your skin prior to the application of the hair removal cream, and then you want to do a test spot. Ideally, you would do someplace on your body, do the treatment as recommended, wait 24 hours, and if it agrees with you, then fine, do the hair removal, but just be cautious because the chemical that works to remove the hair and make it easy for you to wipe away the hair is also a chemical that can burn and break down your skin if it's left in place for too long. Other things that you can do. There is at-home hair removal devices, IPL hair removal devices, and they're not as effective as what we do in the office, but with regular long-term use, they can really permanently decrease the amount of hair you have. They only work on darker hairs, and they're more risky on people with darker skin. So they're perfect for people who have light skin and dark hair, and you need to worry about that. If you're tan, they're not going to work as well. If your hair is light, if it's white, if it's vellus and like fine, it's not going to work as well either. There's a number out there. I actually haven't used any of them yet, but the ones that I've read about and the ones that my patient likes the most is the Braun Silk-Expert, the Ulike Sapphire Air, and then the Nood. And the Nood's particularly good because it has a really long, it has a big spot size, so it's good for like legs. The other ones are better for face hair removal. In addition to that, there's things you can do that just rip out the hair. You can wax, you can tweeze, you can thread. Those are the least popular with the dermatologist group because they actually can damage the hair follicle and make the hair grow back sort of curly and grow back into the skin, which then can lead to unwanted bumps, inflammation, and even sometimes scarring. When you have an ingrown hair, don't go after it. Don't go digging for it, because that also is going to make it more likely you're going to have scarring. So we all tweeze some, but just know if you're going to do that, your risk of ingrown hairs is higher. And so after you wax, after you tweeze, you want to give your skin a couple days to recover, because when you wax, you are ripping off the dead skin layer as well as the hair. So you want to not use your exfoliator for at least 3 days before. Some people, if you have sensitive skin, it really should be a week before. No glycolic, no tretinoin, so your skin can rebuild that top layer of dead skin. Then after you wax, that dead skin's been ripped off, you don't want to use your treatment again for another 3 days, so that your skin can actually become better able to deal with the treatment. So that's the problem with waxing, is it really cuts into your skincare regimen. Then after you get through that sensitive phase, you actually want to go back to using your nighttime treatment, because that will help prevent ingrown hairs by gently exfoliating the skin. In addition to that, there are epilators, which you just rip the skin out, like the good old Epilady from a long time ago. That same thing, the risk of ingrown hairs is higher with that, because you're pulling the hair out from the root and inflaming the hair follicle. And then the last thing is there is a prescription cream. The brand name is Vaniqua. The generic name is eflornithine. And it can be used twice a day to decrease hair growth, and it will decrease dark hair, light hair, gray hair. The problem with it is as soon as you stop, the hair is going to grow back the way it did before. So a lot of people are excited about it in the short term, but in the long term, I don't really have any patients who continue to use it, just because it's really hard to work into their skincare regimen. So that's a lot of information. The take-home point is you have to figure out, do you want to remove your hair? Which way is going to agree with your skin? And then be kind to your skin both before and after you do the hair removal to decrease your risk of complications.